Good afternoon, folks, and welcome back to this Measles 101 in just 10 minutes. Let's just give you a few minutes or just a few seconds to start actually talking about these updates that now in the health department we're doing every 2 weeks, okay? But I'm going to leave you with a question first, and it's basically measles, what should I know, okay? Alrighty, let's begin. Remember that if you have any questions, please feel free to drop them in the chat, and then I can basically help you to understand better if you don't understand something. Okay, so my name is Dr. Jeannette Lopez Bell, and I am one of the epidemiologists working here in the Houston Health Department, and I'm basically focused on infectious diseases. Okay, so measles, what should I know? If you're aware, we've been basically dealing with an outbreak of measles in the West Texas area since basically the beginning of this year. Okay, so I brought some data so we can continue actually to see how it's going. Okay, so the good news is that basically the cases they're becoming like more steady, and this data is basically as of August 6th of this year. Okay, so here in the United States, nationally, we have received 1,356 reports. Okay, but if you see in the map, see how, for example, Texas is in a darker blue color. So that means that basically we're dealing with the cases. So in other words, we're reporting more cases in comparison to other states. And the reason to that is because the ground zero to the infection, it began on West Texas. Okay, basically within Gaines County, we encountered that there was like a population that basically was lacking vaccination, and also with the with all the people traveling, coming in and coming out from the area, that's also was affecting. Okay, now in Texas, basically as of August 12th of 2025, we received basically 756 reports of these measles cases, being basically the west area, the ground zero. Okay, we also have received reports from other areas, including North Texas, but in our region in Houston, Harris County. The good news is that we only reported 3 cases starting the outbreak, but right now we don't have any concerns of any active cases. But that doesn't mean that we have to let our guard down, because actually what it really means is that we have to take precautions since we're still within the same state. Okay, so basically, by age, if we break down by age, basically, children, okay, are actually the most affected. But that doesn't mean that everybody could get affected. The thing with this is that children are most exposed. And now that school actually started, this should be something that we should be a little bit more concerned about. But how can we prevent this? Remember that we have vaccinations and vaccines, they work. Measles vaccines, they're typically given at the first age year of age, 12 months to 15 months. And then basically there's a booster or second dose that is actually given within the 4 through 6 years old. Okay, so why this has been an ongoing challenge, why if measles was actually eradicated or it was declared eliminated in the year of 2000 from the United States, why are we still dealing with this? So the thing is that measles, it's a virus, and basically it was still circulating within the area. That means that with the transmission, basically it was pretty low. But then because of actually all the vaccines questions and all these concerns that were rising through the years, a lot of people, they just opted not to get those their kids vaccinated for whatever reasons. Okay, but turns out that vaccines actually are the ones that are going to be serving to protect us, okay, as a shield. Okay, but let's talk a little bit more, okay, about those countries that actually they have been reported a lot of cases through the world. Okay, and this is as of June of 2025 for the World Health Organization. So basically countries like Yemen and India, they're actually leading in the numbers of cases about measles. And one of the reasons why actually we see transmission is because basically of all the traveling that we have across the globe. Okay, That doesn't mean that you don't really need to stop traveling or anything like that. It just means that you just need to take your precautions if you're going or traveling, or you just travel or came from a country that basically has higher incidence and prevalence of measles. Just make sure that you have your vaccines up to date. And if not, remember that you can always contact the health department to actually, get the vaccinations. Okay. So we have different clinics across town that it can do that. Okay. One of the reasons why measles is increasing, once again, as I was mentioning at the beginning, it's because of the lack of vaccination. Okay. And there's a lot of taboo surrounding all that idea of vaccinations. And through the years, it has been actually reported and also established in the medical literature or academia that these vaccines actually, they don't carry a major concern. Okay. There were like some myths actually like linking the vaccinations with actually autism in children and all that. The thing is that that's actually a myth. It's not true. Okay. So it's pretty safe to get the vaccine. Okay. So how that works is that once you get the vaccine, it's just basically an attenuated virus that is not going to have the virulence to cause actually the disease in your body, but then your body is going to be able to produce antibodies. So whenever you are actually exposed to the virus, basically you are safe. Your body is going to be able to get rid of the viral infection quickly. But what are going to be those symptoms about measles that you need to be aware of? Okay. First thing is that we have a window of time of 14 days. Okay. But the thing with this is that the symptoms, they can start happening about day 3 and day 4. And one of the things that is going to be very important is that one of the major symptoms that we have, it's the rash. That rash, it's going to follow a pattern. Okay. So it's going to start at the level of your head, going down towards your trunk, and then spreading over actually your limbs. Okay. And this rash, once that rash happens or it appears, that person basically started to be infectious from 4 days prior. Okay. So a person can be infectious 4 days prior to the appearance of that rash, the day that it noted the rash appeared, and then 4 days after that. Okay. But what would happen if you were exposed to somebody who was diagnosed with measles, or maybe you're suspecting that it has measles? Okay. First thing that you have to make sure that you or your children or your loved ones is that vaccination status. Okay. Make sure that you are up to date. Okay. And if not, remember that you can call your healthcare provider. Don't go to the office, because you are basically, if you're infected, you're highly infectious, just call them and ask them actually what to do. Okay. So there's isolation processes that you must be following, for example. And also remember that you can wear a mask, because the thing is that measles, it's a virus that it's transmitted by airborne. Okay. If somebody is coughing, or if somebody is sneezing, basically having like flu-like symptoms, actually it could be measles. Okay. Because remember that these are symptoms that we're not seeing only on flu or maybe on COVID infections or things of that sort, like respiratory infections. Because it's airborne, that virus, it could basically still, on surfaces for up to 2 hours. Okay. So what that means is, if somebody was sneezing or coughing or whatever, and then you touches the surface and you grab your hands and put it actually on your face or your eyes, you can actually inoculate yourself. Okay. So remember that right now we have a measles outbreak, but that doesn't mean that we have to panic or run away or do something like that. Just remember that knowledge is power. Get educated. Make sure that you are vaccinated and up to date, and your loved ones as well. Okay. Thank you so much for joining. And this is everything for today, for those 10 minutes of actually measles 101 in just 10 minutes. See you the next time, and thank you.